So, Mr. Gunshaw.
Hello.
What is a facelift?
A facelift is an operation where you stretch skin, remove the extra skin, and then suture it in a new position, or fix it in a new position, so that saggy skin or surplus of skin is removed and the tissue redraped where it once has been when one was a few years younger.
Will the wrinkles return afterwards?
Skin is elastic, and the longevity of a facelift is very much important on the quality of the skin. A facelift can never stop the aging process, so the answer is yes, the wrinkles do return. There are two phases. One, initially you have a bit of relapse in quite early stages, and then we think that most facelift will show some effect for about 5 to 10 years before what the facelift has done is completely taken over by the normal aging process. But having said that, in 5 years or in 10 years, you would probably still look a bit better, because the excess skin that you had, or at least part of it when you first came to the office, is removed, and so you will probably still have a net effect, yes.
Who is the most suitable facelift patient?
The most suitable facelift patient is a patient who has proper surplus and excess skin. So not the one that has fine little lines on the skin, the one that has extra skin, jowls, something at the neck, the mid-face sagging. These typical things are good for facelifts. The tiny little crackles and fine lines in the skin, they're more for rejuvenation procedures, which are called resurfacing procedures. Laser, peel, and that sort of thing. I want to add something. Fillers, of course, they're very good to replace lost volume. So people who look gaunt, and which is also part of the aging process, are probably quite well advised to first use fillers and then later on are suitable for facelift, when the fillers don't do anymore what don't do enough anymore for the patient. Yes.
Will I need to take time off work?
Oh, definitely, definitely. A facelift is a proper operation. We call it a procedure. In fact, it is an operation. A facelift depends on what techniques you use, how the extent is, and who operates it, between 2 and 4 hours roughly. And obviously, again, the more extra skin there is, the more areas are involved, the longer you should take time off work. For a small facelift, probably 2 weeks of work is enough. But for a super extended facelift, I know that people don't like to hear that, but ideally they should be able to take 3 weeks, 3.5 or so off, because the head shouldn't be moved much in the healing period. It just heals better and reduces complications.
Will I feel pain afterwards?
Well, discomfort at least, yes. I would say, I mean, do you call it pain? Do we call it discomfort? The pain threshold in patients is of course very different from individual to individual. Patients are usually okay with paracetamol and ibuprofen, and that tells you that medium type pain discomfort is probably what most people experience. There are some who say, well, they didn't have anything at all, and some said it was a bit more than they expected, but there's usually some discomfort and pain, yes.
Could I have eye rejuvenation at the same time as a facelift?
Oh yes, that is actually very popular. That is popular. I mean, usually with most people, the first part that ages are actually the eyelids, and the second part is more that the jowls come, the excess skin here, the nasolabials. You can do it together, just the operation gets quite long. So I would think, at least in my practice, most people make 2 operations out of it, which is perfectly fine. It's less strenuous on the patient. On the other hand, people who are very short of time, where it's difficult to take time off work, they like to do it together. I personally think it's easier on the patient to divide it into 2 procedures, if they can.
And will there be any scarring after a facelift or combined facial surgery?
Yes, first of all, every surgery produces scars. When you cut skin, there's a scar, and scars never go away. You can only put scars most often in areas where they're not very visible. Or you can try to stitch nicely that the quality of the scar is good, and then the patient also needs to help by not moving much and have the right skin. But the answer is yes, there is a scar. Depending on where you cut, there will be a scar. The shorter facelifts, they usually produce scars somewhere here in front of the ear. And via this, you can probably, this cut, you can probably lift some skin in this area here. As soon as it goes more direction neck, you would probably need to cut around the ear and make a cut behind the ear too. And sometimes, if there's a lot of extra skin, even cut the hairline. And the same here. Sometimes, if you want to lift the upper part, you might basically need to cut more here or with an incision like so. So in other words, yes, there are scars and they will never go away, but you can actually usually put them in a region or make them so neat that they are not really bothering. But I would always find them. I mean, there's no facelift on earth where I can find the scar. Of course you can.